hear me all right? Yeah? Thank you, John. I am Chris Ricketts, and the first thing to say is I'm not Paul Sly. Paul Sly being our Chief Executive, who's away at the moment. And so I'm coming to give you a bit of an update, really following on very much from the previous DCO event back in November. I apologise in advance if I repeat some of the key messages that we had on that particular day. But thank you very much for the opportunity for coming along and updating you. In brief, our position in the local NHS is quite different and distinct from that of local authorities, and in particular Dorset County Council. In that NHS funding, as you will have heard in the press nationally, has been protected. And that's very much appreciated through a time of really a very tough financial situation. However, there are it's important for us to recognise ourselves as an organisation and more widely that there are significant cost pressures within the system for NHS and NHS locally. In that our projection in terms of our financial spend for NHS Dorset is going to be pretty much flatline really over the next 3 years. And that is really quite distinct from where we've been previously, in as far as the NHS has known very considerable year-on-year growth over at least the last 10 years and really beyond that. And so we're entering times in terms of NHS, and particularly many NHS staff within our organisation, where actually this is the first sustained period where there has been and will be no funding growth. And that's interesting because, of course, there are significant pressures around continuing to increase spend in the NHS, which we need to work with. So, for example, and I think David in his first presentation mentioned the ageing population, and that's an issue nationally, but it's a particularly acute issue for us in Dorset. And people in the room will be aware of the kind of demographic challenge that we have in Dorset around the increasing number of people who are ageing. And in actual fact, there you go, I say these things, and of course everyone's ageing, aren't they? But of course we are looking at an increasing older population in Dorset very considerably. Part of that, it has to be said, is that people in Dorset are healthy and do live a very long time, very pleased to say. And so, but of course, that does provide quite a lot of challenge in terms of really good quality of care and ongoing treatment, particularly for the older population. I think the other thing that we need to acknowledge is that the costs of provision of healthcare continue to increase. So we're very familiar with increased prescribing costs, for example, within the NHS. The increased costs of treatment, and of course the expectation that the public have of improvements within the system as well. And so with all of this in mind really, we are very mindful that we have to commission and provide NHS care locally which is of really good, effective quality, and that we're commissioning for good value as well. So whilst our financial position is clearly much better than the County Council's position at the current time, there are still challenges for us within the system. But our priorities in Dorset very much remain the same that they have been really for at least over the last 3 years as NHS Dorset. In as far as our aim is to improve the health of our local population, and in particular picking up on issues around inequality that we know and experience in Dorset, significant inequalities between different social groups and indeed the outcomes in health that they experience. So we have a commitment, we have a current programme of work looking to improve quality within the system, looking to increasingly innovate as both in terms of commissioning and provision of services across Dorset, we're constantly looking at the productivity of the services that we commission to ensure that actually we do have good value for money. And of course we continue to be committed to the preventive agenda. And that brings me on to a couple of points I wanted to raise by way of update since November. In the interim period, we've had a white paper published nationally on the future of public health services. And that gives us some really interesting and really exciting new abilities to work much closer together between NHS and local authority in the future as well. In actual fact, what has been set out there is that the local authority, top-tier local authorities, so in our case Dorset County Council, will become primarily responsible and accountable for public health services and working together with local NHS in improving health for our local population. And the changes that will take place across that time period will be consistent with some of the broader changes taking place within the NHS too. So that's one key area of update. The white paper also specified changes in the arrangements at a national level as well. So they're going to be establishing a body nationally, which is called Public Health England, a distinct part of the Department of Health, and that's really about the bringing together of the National Treatment Agency, which some people will be aware of, and also the Health Protection Agency, and have a lot of health protection and health improvement responsibilities. And locally, and I suspect sitting there, you may be thinking, what's the future look like in terms of who do we as organisations need to be working with locally, and what will the commissioning arrangements look like in future in Dorset? We're looking forward to establishing a new body, a new partnership body called the Health and Wellbeing Board. And that's something that we're in quite early days over discussing together with local partners. We have already some really good partnership arrangements between NHS and other local authorities and partners locally. And the Health and Wellbeing Board will be established over the next year or so in shadow form and then with full responsibilities for commissioning on behalf of the local population. The other significant change which has happened since November has been that in Dorset the local GPs have come together and worked together in developing plans for arranging a GP consortium. You'll be aware within the press that GPs are going to be very much at the centre of commissioning NHS services in the future. And the arrangements of GP consortias, these consortias are going to be the bodies through which the majority of NHS care is commissioned in the future. In Dorset, the GPs have come together, put in a proposal and gained Pathfinder status in a second, I think it's the second wave of Pathfinders for GP consortiums in the country. And effectively, they are seeking to establish a GP consortium on the same footprint or geographical coverage as NHS Dorset is currently. And we see this as a very positive development within NHS Dorset, in as far as we already have GPs and clinicians right at the centre of our commissioning arrangements. The programmes through which we commission currently all relate to a body within the organisation called the Professional Executive Committee, or the PEC, which is made up of clinicians. And effectively, the new GP consortium will be picking up the responsibilities and is effectively formed already through the Professional Executive Committee. So we will see in future the GP consortiums gaining strength and taking on the commissioning of NHS services for the future. Public health and local authorities will be importantly linking with local GPs through the development of these new health and wellbeing boards. And so that's going to be the key forum through which the voluntary sector, community sector will be engaged around the commissioning of health and health improvement for the future. So really, I said I was going to keep it brief, and that's very much my plan. I just wanted to highlight those two significant developments which has taken place since last time. Very happy to take any questions from the floor. Thank you.